Hi, it's Jennifer, and I am coming to you February of 2017. I am wearing red today in honor of Wear Red Day for heart disease and stroke awareness. And my t-shirt is, it says, I live because of my donor heart. Um, and it's been exactly, well, almost exactly 2 years since I got a heart transplant. So I call it my Heartiversary. And let's see, a lot of things have happened to me in the 2 years since transplant. And I've had some health hurdles, but I've overcome them. I had breast cancer, and I got breast cancer reconstructive surgery, and I'm sorry, I should back up and tell you I had a mastectomy, then reconstructive surgery, and I'm pretty disfigured, and that's a source of disappointment and challenge. But I'm it's just it's so funny. If I had to do transplant in my 20s, I think I would have been a lot more challenged, because I think as I've gotten older, I'm 41 now, not that I'm, so old and wise, but for me personally, I've learned to become more patient, and I've learned to take and tolerate a lot more than I think I could have done in my younger years when I wanted, things to be a certain way. And so I thought I would have boob job boobs, and I do not. I do not. Reconstructive surgery for breast cancer makes you look near normal, but nowhere as normal as you want to be. So, from a cardiac perspective, I'm doing great. I go in next week for my annual checkup, and I will have more tests to confirm that. But so far, so good. No rejection. We don't like to say the R word, but I will say it so that you know what I'm talking about. And but not only that, my ejection fraction is doing well. It's normal in the 60s. And the thing that's challenging is physically, I've gained weight, and I have problems with resistance. So like going up a staircase, I still might be a little short-winded, or I mean, I can't run. I can walk, I can do cardio, I can do a cardio workout, but I cannot, I just have diminished lung capacity. I think actually it's more my lungs, but that's a radiation issue. I have a lot of late effects from when I was a kid with cancer. I had bone cancer, Askin sarcoma, which is a subset of Ewing sarcoma, in my chest wall when I was 15 years old, and the chemo and radiation caused me to have breast cancer and need the heart transplant, and then also get breast cancer. We call it a cancer sandwich in my family because it's cancer, heart transplant, cancer. Yeah, that's hysterical, Jennifer. Just so funny. I'm trying to make this video short and sweet, just as a big update on my life at 2 years post-transplant. Something that I have not talked about is that my mother died in June of 2017. And she and I had a parallel experience in that I went to Dallas in June of 2015 when I heard she was going to the emergency room for a stomach bug, stomach pain. And right there in the emergency room, we learned that it was metastatic cancer and that she had the cancer in her stomach. And that is also 2 weeks later, I fell sick again with congestive heart failure. And that's when they decided to do the heart transplant workup. And then I was in Dallas for 2 years. I lived in Dallas with my sister. My home with my husband is 3 hours away in Austin. And I only had visits home for like a weekend here and there. 1 month in 2 years is the longest I stayed at home. And that was well after transplant, because you can't leave the organ procurement zone when you're on the wait list for transplant. Then I got the transplant and had to recover, and took a long time for me personally to recover. Had some challenges. And then my mother, I stayed around for my mother, and she died on Flag Day. So I'll just think of flags waving at me. And it's a special day and time because my birthday is 2 days later. And, I believe that as you enter life and give birth, you also have to leave this planet. So those will be special days for me as I remember her. I called her Mom, and my mom was... She was really beautiful, and she always had my back. So I will end this video now and just tell you that I'm still grieving. As you see, it's only been 7 months since her death, so I apologize for the tears, but such is grief. And to let you know that overall I'm doing really well. I'm volunteering. I live at home. I'm walking my dogs, and I think that it's extraordinary to get a heart transplant, and I'm very grateful to my donor family. I don't know them. I've written off to them. They know about me. They know who I am, but they've chosen not to engage, and that's okay. Each person's on their own path there, but I have deep gratitude to my donor family, and I have very grateful to my husband and my sister and my family and friends who have held my hand and wiped my brow and fed me. I've been shown incredible kindness and love. And that is my wish for you, if you are watching this video, that you may have the care and love that has been shown my way. May it come to you. And take care. Bye.